We covered a lot about the basics of measles, important information for people who live in Buncombe County as we began to see more and more cases around us and within our own community. So feel free to go back and watch that first round of Let's Talk Measles, where we had Dr. Ellis Matheson, Public Health Director, and our friend Dr. Mullendore, Buncombe County Medical Director, in that discussion. And today we are very excited to have one of our local pediatricians, Dr. Brigette Fogleman, pediatrician and partner at Asheville Children's Medical Center.
That's right.
Thanks for joining us.
Thank you for having me.
And she's going to help us understand why we need to take measles seriously. So far, 6 people who live in Buncombe County have had confirmed cases of measles infection. Sites in Buncombe and other North Carolina counties where measles exposures have occurred are updated regularly on the North Carolina DHHS website, Measles Metrics webpage, every Tuesday and Friday by noon. It's a great resource if you haven't seen it already. As I mentioned, we are joined by our friend and medical director, Dr. Jennifer Mullendore, and she is going to help us navigate these questions and this conversation. We opened questions up prior to our Facebook Live event today, so we have and tried to include some of those questions in our topics of conversation, and also we'll be hitting some of those more specific questions towards the end of our initial conversation. So with that, let's go ahead and get started. We know that unvaccinated children are at the highest risk for getting the disease and for possibly experiencing complications, just like we've read about. Why is that?
With vaccination, it gives your body a chance to make some protection against the virus and the germs that are circulating. And so with measles in particular, it's a heavy virus, it's a heavy illness, and can cause some serious complications. So by getting the vaccine, you can have an edge up on the virus. And then if you experience it out in the world, you have some protection already, and so you end up being able to fight the germ better if you even get it at all. And so there are a lot of different complications that can happen with measles, and by getting the vaccine, you can fight it better, basically. So people who are unvaccinated do not have the protections to help fight off the virus. The virus can be a more serious illness in that circumstance, and then you have the complications can arise much more often. So pneumonia can happen in 1 out of 20 unvaccinated children. Encephalitis, which is swelling in the brain, can cause seizures, hearing impairment, brain damage, death. You can have immune amnesia, where your body just kind of forgets about the viruses and the germs, the bacteria that you've fought off illnesses in the past. And that can literally the measles virus can wipe out 70% of your antibodies that you've had from prior infections, so now you have to start all over again, just like a little baby. So it puts you at risk for those infections. And then rarely, but very dangerous, is a condition called subacute sclerosing panencephalitis, which is scarring in the brain, a degenerative neurologic condition that is fatal, and that can literally occur up to 7 to 10 years after an active measles case. And with children in particular, very dangerous, infants especially, so we want to protect those infants. We try our best to keep this virus from spreading by vaccination. That subacute sclerosing panencephalitis can happen 1 out of 600 unvaccinated children, and that's a pretty high rate for a serious condition like that to have that occur. So we try our best to keep it from spreading. It's one of the most contagious germs we know of. So we do our best with increasing our fighting power, and with high rates of vaccination, it keeps the virus from circulating as much. And then we don't have the infants who are not able to get the vaccine yet exposed, preferably. So that's part of the reason why we're talking about it.
Yeah. Thanks. That was I've never heard some of those stats before, so thanks for sharing that.
It's scary. 1 out of 3 children less than 5 years of age will be hospitalized from some complication with measles.
Wow.
And the treatment for measles is basically just supportive. It's a virus, and so it's fluids, rest, analgesics or pain relievers, ibuprofen and Tylenol. We don't recommend aspirin in children or teenagers. That can cause other complications. But Tylenol and ibuprofen are okay. And then if someone's hospitalized with measles, if they have pneumonia, they get oxygen to help support them through their illness. And occasionally vitamin A, there are some studies that vitamin A can be helpful when hospitalized and monitored really carefully. So it's not a prevention. It does not prevent measles. It does not cure measles. It can help assist someone who's already hospitalized and being monitored carefully. So we do not recommend vitamin A to be given at home in an unmonitored setting, because there were serious complications with vitamin A toxicity. And with the outbreak in Texas, there were quite a few cases of vitamin A toxicity and liver damage and some serious complications with kids, people.
You have anything to add, Doctor?
I don't think so. I think we're good.
All right. Well, so another thing I'm not vaccinated because I want my immunity to do the work, not the vaccine. Is this an accurate way to look at your immunity?
So the issue is that if you have never been exposed to something, your body doesn't have the blueprint, right, to fight that infection off. And so you are at the mercy, right, of your body fully and from scratch trying to fight off that infection. You have no heads up on that infection, and so that often causes then you to be more seriously infected and have more severe complications. Vaccines, right, can provide a blueprint to your body, sort of how we all update our phones and our computers now, right, to get protection, right, in advance of things that are out there and circulating.
Even though we don't like those updates.
We don't like the updates, but they're for a reason. And
Absolutely.
so that's what a vaccine is doing. It's giving your body the blueprints, the update it needs to be able and prepared to fight off any germs that it might encounter. And so, back before there were vaccines, people had nothing but their natural immunity to fight things off. And unfortunately, what we saw were lots of people getting seriously ill and dying. Mm-hmm. If we go back generations and not very far in our families to the early 1900s, families lost children regularly to measles and other things that we now have vaccines against. So, I'm a parent. I do not like when my kid's sick in any way. This morning, he was complaining of feeling like sick on his stomach and having, being hot. And so my response is, oh my goodness, what's wrong with my kid? So I am all about doing things for him to protect him. And so to me, vaccines are by far one of the most important things I can do to give my kid the healthy, heads up on what he could encounter in the world.
Yeah.
Well, the thing too I like to keep in mind is that we don't create vaccines for every little bump and sniffle. It's for things that have caused major suffering and plenty of deaths. They're not going to spend time and money into creating a vaccine for something that causes sniffles. And so measles caused a lot of suffering. I think prior to the vaccine was in 1963 was when the vaccine was first out. And before that, there were 3 or 4 million cases every year in the U.S. of measles, and I think 50,000 hospitalizations every year.
Yeah, and hundreds of
deaths. Yes, every year. And there's a way to prevent it with a vaccine. So it's worthy.
So like you mentioned earlier, and we've heard more recently in the news, measles spreads very easily. So this is one of the reasons why we have a quarantine and isolation period or requirements. Mm-hmm. Can you explain the differences between those and how it can impact people's day-to-day lives?
Yeah. So quarantine and isolation are things that we've used in the world for centuries, right, to control the spread of illness and to protect the community. So these are not new, but they are tools that we have. So quarantine is it separates people who have been exposed to a contagious illness, like measles, and it separates them from others, and we are waiting to see, will they become sick, right? Isolation separates people who already have symptoms of the illness, or we suspect they have a contagious illness, or we have confirmed through lab testing that they have a contagious illness. And so again, the point is to keep people from spreading germs, or people who might develop these germs from spreading germs. And we also have the ability to not necessarily quarantine someone to their home, so make them stay at home after exposure, but sometimes we can restrict their movement or exclude them from certain high-risk settings. So we may say, okay, you don't have to stay at home, but you shouldn't go to school, you shouldn't go to childcare, you shouldn't just show up at your doctor's office without calling ahead. You shouldn't go to these higher risk congregate settings where there's either more people that you could spread an illness to, or a vulnerable population. So like infants and a child care who can't get vaccinated. So again, like these are tools we have to protect the public, to protect others you might encounter. And so for measles specifically, if someone is sick with measles, confirmed to have measles, they are supposed to stay at home. So they are isolated. They stay at home, don't go anywhere until it has been at least, past the 4th day after their rash developed. So like on the day 5 after their rash developed, they are considered released from isolation and they can go back into the world because they're no longer considered contagious. If someone has been exposed to measles, so they don't have it, but they've been exposed, they are the incubation period. So how long it might take for measles to show up could be up to 21 days after their last exposure. And so the guidance is for those next 21 days, they either need to be quarantined, so stay at home away from other people, or possibly at least restricted from the high-risk settings. So they might not be able to go to school or work for 21 days
Long time.
after that exposure. That is a hardship. I mean, definitely that's a hardship. We don't issue this guidance lightly. We try to be the least restrictive we can be in public health. But we have to also protect the community, right? And so just encourage people to think about, what would my life be like if my kids couldn't go to school for 21 days? Or if I couldn't go to work for 21 days? How would I pay my bills? How would I get food? How would I, whatever it is you do, just think about, is that something that I'm okay with? And if it's not, we have an answer. Get your vaccine. Have some sort of proof of immunity. So if you know you've been vaccinated, we've talked about this before, find a copy of your vaccine record. There's no harm in getting another dose of the MMR vaccine if you've already had it and just can't find proof. So again, just thinking ahead, just like I tell my kid, think ahead. Again, we're not trying to be punitive. We are not trying to be mean. We are just trying to stop the spread of illness.
So 21 days is a long time. How do I get out of that?
So again, now is the time, before you've been exposed to measles, find that shot record. Talk to your parents, check your records, talk to your doctor. And if you haven't been vaccinated or you can't find proof, get a dose of the MMR vaccine. Which again, the last one, we went into all that.
We did.
And the other thing too is, I know that we've heard some people say I'll just wait until I've been exposed, because I know that there's something called post-exposure prophylaxis, which is after an exposure, you can get a dose of the MMR, but that is within the 72 hours after exposure. And let me just tell you that it takes time. Someone has to go to the doctor, has to get tested. The test result has to come back and show that they have measles. And then public health does the contact investigation, see who was contacted. The likelihood that that's all going to happen within 72 hours is extremely small. And so rarely do people have time to get that MMR dose within those 72 hours. Right. And so I wouldn't wait on it. I would be proactive.
All right. Dr. Fogleman, I think that your perspective as a local pediatrician is super important. And so I would like to learn from you how your office has adapted to measles in Buncombe County, and have you changed any of your procedures at your office, and what kind of concerns are you hearing from parents?
We definitely have made some changes just out of concern for protecting our little babies. We see babies as young as 3 days of age all the way up to young adults. But the infants in particular that are too young to get the vaccines are our most vulnerable population, and being that we have so many of those coming into our office, we're really concerned, and rightfully so, that the parents are concerned as well. And so we've made a lot of changes, several big changes that are hopefully preventing exposures to our little babies. So if somebody calls into our office for a sick visit, we have that if it triggers a concern, goes to our triage nurse. So then that appointment is being made by an actual RN. And if there's any concern whatsoever that it could be any symptom of measles, then we see them in the parking lots. So we're doing parking lot visits in the snow, in the ice, whatever. So we're doing our best to try to keep those from coming into our office. And so far, none of those have actually led to testing as of yet, but I'm sure at some point might come up. And we don't want to run the chance that that person comes in and has a potential exposure to our babies. Measles hangs in the air for 2 hours, right? And so somebody comes in and leaves, and then it's in the air. So we have to be really proactive about it and just not even allow that to happen. And again, it is not a punishment to our patients that might meet the criteria for measles. It's just out of pure protecting our babies that are coming in the office and our other patients.
Oh, quite an
So we've done
adjustment,
that.
yeah.
And then when people are coming in for their well care visits, we screen them upon arrival. And if they have any concern, anything that's concerning, then we ask them to go back to their car and have a nurse call them to discuss that further. And then for our infants that are there for well care, we've been offering the MMR at 6 months of age, which I don't know if you guys have talked about that in the prior talk, but that is something that we can do to help prevent our 6 to 11-month-olds from being sick with measles.
And I think that has been a change since our last conversation.
Yeah.
And so do you have anything to add?
Yeah, so because we have seen community spread of measles in Buncombe County, the state, North Carolina Department of Health and Human Services, is recommending that healthcare providers, consider administering MMR vaccine to children or to infants who are 6 months to 11 months of age. So like we've said before, usually the first dose is given at 1 year of age, but because of the potential risk and the severe complications, like Dr. Fogleman mentioned, it's a consideration. So we know that, practices have in our own health department immunization clinic have sort of taken that upon themselves. And so if a parent is interested, we encourage them to talk to their healthcare provider.
And I've been getting a lot of questions from parents about, well, why do we normally get this vaccine at 12 months and not 6 months? Is it dangerous to give it at 6 months, or is it safe to give it? It is very safe to give it at 6 months. The optimal time to give the vaccine is at 12 months because you produce a better response to the vaccine. You have 93% immunity after that first dose at 12 months. So when measles is not circulating in the community, it's better to get it at 12 months. If you get it at 6 months, it gives you some protection, but it is not optimal. So that is why we don't normally give it at 6 months. But it's safe to get it at 6 months of age. It's not, to me, it's a very safe vaccine to give in general. But I think a lot of people have wondered, it's a reasonable thought. Like, why don't we normally give it at 6 months?
Yeah, and typically, the vaccine schedule that has been created over the decades is really based on when is that child most vulnerable, that person most vulnerable to the illness. and when like their immune system is able to have the most robust response to the vaccine. So there's science behind that.
It's very calculated, very studied.
So I didn't know that. The 12-month mark is an optimal or a better immune response outcome, right? So
Yes.
I didn't know that.
Yeah.
Thank you. So while we're talking about the MMR, let's take a little bit of time to dispel some myths about the MMR vaccine and measles. I mean, you talked a little bit about vitamin A earlier. So you talked a little bit about how it can be a therapeutic, or I'm not a medical person at all, so I'm going to let you talk about, the thought that vitamin A can both prevent and cure measles. So what does the science say? Just quickly reiterating what you said
some
earlier.
studies that show in a controlled setting, when the dose is monitored, the levels are monitored, the child or the patient is monitored, that it can help, particularly in children less than 2 years of age with pneumonia specifically.
Wow.
And so I did not find anything that showed benefit for encephalitis or the subacute sclerosing panencephalitis, any of that stuff. And then there is no data to show that it prevents measles. So the best prevention is by getting the vaccine. Vitamin A does not prevent measles.
Thank you. Another is that common thought we hear, or word on the street, that vaccines cause autism. What do we know about that?
There are multiple studies from around the world, mind you, not just from the US, from around the world, that show no credible evidence of any link between vaccines and autism.
All right. Thank you. All right. So those are the key points that we kind of outlined for this conversation, but now we're taking a couple of questions from our pre-submitted questions. And the first question: how are local hospitals protecting their parents, babies too young to receive the measles vaccine, from being exposed to the significant number of cases of the measles presenting in the ER?
So I will say clinics like Dr. Fogleman's, right, where you don't typically have walk-in patients, right? People typically call, schedule an appointment. It is much easier, still not easy, but much easier to, screen, like ask questions before people show up in your office to determine, does somebody are they likely to have measles, or potentially do they have measles? In a place like an emergency department or an urgent care where they do walk-in clinic or walk-ins, that is a totally different setup, right? And it makes it very difficult. You can't pre-screen people coming into the emergency department, right? You can't turn people away coming into the emergency department. And so it is much harder. And you can see, like, across the country, not just locally, but across the state of North Carolina and South Carolina and in other states where they've had measles exposures, emergency departments are common places, right, where there are exposures because of that fact. And so I know that the local hospital systems are, posting signage that if you have these symptoms or you've been exposed to measles, they want you to mask, they want you to tell staff right away. And the recommendation is get that person directly into what's called an airborne isolation room. Those rooms are not typically available in outpatient clinics. So urgent cares don't have isolation rooms. Private practices don't have isolation rooms. Our health department doesn't have an isolation room, right? So these are very higher tech rooms that are available at hospitals, right? But again, to get to that room, it's not a door from the outside. You have to go into the building to get to the room. So there's just really no way I can ever see where an emergency department would be able to prevent potential exposures. It really becomes on the part of the person, right? The public, the person who has the illness needs to call ahead, right? And then safety measures can be put into place as best as possible to get them the care they need in the safe way. Does that make sense?
Yeah, absolutely. Yeah, it's a major change in operations.
We don't build
at a large scale all the way
Yeah.
down to a smaller scale, even within our own, health department. So
So that calling ahead is critical. If you have signs and symptoms of measles, if you've been especially if you've been exposed, call ahead before you show up.
got it. We talked a little bit about treating measles earlier, so I'm not going to include that piece of this next question, but breakthrough cases are happening among vaccinated individuals along with cases among non-vaccinated individuals. So can we talk a little bit about that?
Yeah. So if you look at, again, any of the data that came out of like the huge Texas outbreak, the even bigger South Carolina outbreak, and even locally, the vast majority of cases are occurring in people who are unvaccinated. All right. You will then see cases in partially vaccinated, so that people who have had one dose, like children who maybe didn't get that second dose of MMR that is recommended. And you will occasionally see some cases in people who are considered fully vaccinated. But again, vast majority, over probably 95% of cases are occurring in people who are unvaccinated. And the reason why in people who are vaccinated is if you are so let's say I am fully vaccinated, which I am, and I am surrounded by people who have measles. My immune system is just getting bombarded by that measles virus. The vaccine, my 2 doses of varicella or of MMR vaccine are 97% effective. They're not 100% effective.
Right.
Mm-hmm.
So all that plus all that measles virus coming at me, it's possible. We see it. It happens not just with measles, it happens with other vaccine preventable diseases too. So it's not unexpected. But again, statistically, it is a very small number. And so those of us who are fully vaccinated should feel really good, all right, that we're not at risk. But yeah, it's going to happen.
It's one of the best vaccines that we have, really.
Yeah.
The MMR, as far as preventing illness. I mean, I think 97 and 99% is pretty good.
Yeah.
But I wonder how many of those breakthrough cases occurred in household contacts.
Where you're just constantly exposed. And that, again, the virus is lingering in the air.
Your immune system can ward off, so much stuff. But if you have so much coming at you, it makes it harder.
Sure.
Yeah.
Are cases being tested to find out if they are wild-type measles or vaccine strain cases?
And in circumstances where someone develops symptoms of measles, and we, determine that, they had a measles vaccine recently, in the preceding weeks, there is specific testing that is done. So those specimens currently in North Carolina, those specimens get routed to the state lab of public health and then sent to a reference lab, which I believe is in Wisconsin, where they can do this specific testing to determine wild-type measles, so the measles that is the disease versus vaccine strain. And then if that shows that it was vaccine strain, it is not considered a case of measles. There are, it's not an insignificant number of people who will develop symptoms following the measles vaccine. And it's just really important to know that those people aren't contagious. They don't really have measles, the contagious form of measles. And it's something that, again, as we're, in a situation where we're seeing more measles, more people might be getting vaccinated who weren't previously vaccinated, we're going to see these sort of vaccine-related measles cases more, right? More vaccine, more risk for measles-related not vaccine cases, but measles-related or vaccine-related measles symptoms. And so it's just something that normally we don't really think much of because we're not worried about measles, right? We eliminated measles in the United States in the year 2000, right? Did you ever in your career, were you ever
Never.
Right. And
this is absolutely unimaginable when I started my career that I would ever be wondering how to diagnose or how to treat or how to.
Right.
I never had to worry about it.
Right.
I've been doing this 25 years.
Yeah.
It's very telling. Let's see. So, when someone is considered vaccinated, as in COVID, COVID vaxes were considered unvaccinated until 2 weeks had passed after their vaccination. If someone gets symptoms within a day or two of vaccination, would this be considered a vaccinated or unvaccinated case? You just
Yeah, so they would probably be considered unvaccinated because they were probably exposed to measles before they even got vaccinated
Okay.
too. So yeah,
Because
again, we do the
long
testing.
incubation.
But they would most likely be considered unvaccinated. Yeah.
all right.
So none of, when you hear about the numbers
Yeah.
of cases
Those are
in a
all-
community, those are all acquired either by a known contact or community spread.
Yeah,
Those
it's
are
not
not
related to the
vaccines.
vaccine. Nope.
Those are all the questions that we had before Let's Talk. So we're all good, Catalina. Thank you. So if there are no more questions, we're going to go ahead and wrap this conversation up. First, just want to make sure we have some key takeaways for parents and those who are watching. Dr. Mullendore and Dr. Fogleman, what is one thing our listeners can do this week to ensure that they stay healthy and protected against measles?
My number one recommendation is to get the vaccine. If you're eligible to get it, make sure you're vaccinated and up to date.
Yeah. I mean, know your immune status, like we've said before.
Got it.
And to know that, I fear that there will be people that are skipping their well child checks, because they're afraid to come in to the office, whichever office that might be, to get their child their well check and their other vaccines, and then we have other issues. So I imagine any of the other practices have protocols in place.
Yeah.
I like to make sure that people know going to a facility where there's a protocol in place is one of the safest places to be, as opposed to a grocery store or a restaurant or something. So please don't skip your well care.
Yeah, thank you for bringing that up. So we will go ahead and wrap this up. More information on measles in Buncombe County can be found at buncombenc.gov/measles. Thanks to both of our guests today for helping us continue this conversation about measles and for giving us some, practical tips and, accurate information on how to best protect ourselves, and also just more about the response here locally, because as y'all both said, we haven't seen this, so we're all in this together, protecting each other. So thanks again for your help. Thanks to everyone watching the Facebook Live, and hope everyone has a great afternoon.
Thank you.